Okay. Good afternoon. My name is Millicent Price, and I am a graduate student at Alabama A&M University. I am this fall semester of 2025. I am completing my field practicum at Clark County DHR in Grove Hill, Alabama. My video today consists of my report, my agency report, which basically describes different aspects of the agency that I will currently be completing my field practicum at. I will begin by discussing my agency purpose. And my agency purpose is related to competency at one A and B. The Clark County DHR Department of Human Resources is a state-run agency which was founded in 1986. It roots trace back to 1919 with the formation of the Department of Child Welfare. Through subsequent structural and legislative changes, including the Social Security Act of 1935 and rebranding efforts in 1955 and 1986. It has evolved into a comprehensive service provider committed to protecting vulnerable populations. DHR's agency mission is to provide for protection, well-being, and self-sufficiency of children and adults. Child Welfare Division mission is to help families receive the least disruptive services they need when they need them and for only as long as they need them in order to maintain children in or return them to a safe and stable home. My function in the agency as a field practicum student, I support the child welfare division through tasks such as participating in home visits, reviewing case files, assisting with documentation, and observing court proceedings. I also contribute to client engagement and service planning under supervision. My perceived role, see myself as a learner, observer, and a contributor, bridging theoretical knowledge from the classroom with real world application. I supported caseworkers in delivering effective services while enhancing my understanding of ethical practice, trauma enforced care, and cultural competence. Um, Demonstrating professionalism according to the National Association of Social Work Code of Ethics. The first one is integrity and service. I maintain, and I demonstrate this by maintaining confidentiality, adhere to agency policies, and prioritize clients' well-being. The second one is dignity and self-worth of the person. I treat clients with respect regardless of their background or circumstances. Competency, competence, competence. I ask for feedback, reflected on my work, and sought to grow professionally. B, formal organization, which is related to competency 1A and B. The formal organizational structure of Clark County DHR is hierarchical, with the county director overseeing all operations. The agency is divided into specialized units which include child protective services, foster care, adult protective services, and financial assistance slash TANF, family services. The organizational chart um consists of it starts from the state DHR commissioner, which trickles down to the county directors, and it goes from there to the program supervisors and CPS, foster care, APS, and financial assistance. It goes from there to social workers. And last but not least, interns, field students as myself. Impact on service. This structural allows for specialization and clear delegation of responsibilities, ensuring that clients receive targeted services from trained professionals. However, it can sometimes create communication gaps between departments. My place in the structure. As a field student, I worked under the supervision of a licensed I currently work up under the supervision of a licensed social worker in the Child Welfare Division, reporting indirectly to the program supervisor. Target populations, competency 2A and B, competency 3A and B. Case base. Clark County DHR serves children, families, and vulnerable adults, particularly those at risk of abuse, neglect, and financial hardship. Key needs addressed: child protection, foster care placement, adult protection, family reunification, access to food and financial assistance, and support for low income and underserved populations. Considerations for diversity. The client the agency follows culturally competent practices, offering translation services, individualized service planning, and sensitivity to race, gender, sexual orientation, and social economic status. Staff receives training on implicit biases and cultural humility. Unmet needs, and this is just my perception. Access to mental health services remain limited in rural areas. Transportation can be a barrier to attending court, medical, or DHR appointments. Affordable housing is a persistent issue for families trying to reunify with children. Agency engagement practices. Clark County DHR engages with families through family team meetings, home visits, and community partnerships. The agency recognizes values diversity, striving to offer equitable and inclusive services. D. Funding, which consists with competency 2A and B. Sources of funding, federal funds, Title 4E, TANF, SNAP, Medicaid. State appropriations, which is Alabama state budget allocations. And last is local funding, which is limited sometimes, mostly for community outreach or specific initiatives. Budget oversights. The county director, in coordination with the state DHR Financial Division, is responsible for budget planning and oversight. Fund allocation. Most funds are directed toward direct client services, staff salaries, foster care placement, protective services, and administrative costs. Understanding justice. Funding decisions reflect efforts to promote social and economic justice, but limitations in state and federal funding often restrict the scope of services. As a student, I learned to advocate for clients by understanding the intersection of policy, funding, and client access. E. Physical structure, which deals with competency 3A, location. Clark County DHR is located at 22609 Highway 84, Grove Hill, Alabama, 36451, where it has operated for 49 years. Accessibility, the office is an ADA competent. The office is ADA compliant with wheelchair accessible entrances and parking. Public transportation access is limited, creating a barrier for clients in rural areas. Facility condition and first impression. The facility is secure, professional, and clean, but could benefit from modern updates and client meeting areas. My first impression was that it felt structured but welcoming. Barriers to access, limited transportation options, limited office hours for working families, and clients may face stigma or fear associated with DHR involvement. F, agency policy, competency 2B, competency 5A and B, and competency 6A. Legislation and policy drivers. The Alabama Code Title 38, Human Resources, Child Abuse Prevention and Treatment Act, Social Security Act, Title 4E and Title 4B, Family First Prevention Services Act, organization values, demonstrated client-centered service, ethical decision making, trauma-enforced care, culturally sensitive practices. Selected policy, mandatory reporting of child abuse, daily practice, all staff, including interns, are required to report sus- suspected abuse or neglect immediately. This policy is carried out through daily team communication, documentation, and regular training. The strengths, which are protection of vulnerable children and encourage early intervention. The weaknesses are may unintentionally create a fear or mistrust among some communities. Relies heavily on interpretation and discretion. Advancing justice. Clark County DHR actively engages in practices that promote equality and justice, such as using family preservation services to reduce out-of-home placement and promoting um, reunification when safe and appropriate. Agency records, competency 1 ABCD, confidentiality practices. All client records are stored in secure digital databases. Interns must sign confidentiality agreements and undergo HIPAA training. Discussions about cases are held in private areas only. Use of technology, use of FACTS, which is the acronym for Family, Adult, and Child Tracking Systems to engage case files. Emails and digital communication are encrypted. Remote access is limited to authorized personnel only. Presentation, competency 1, B, and C. Throughout my practicum, I maintain professionalism by dressing in professional casual attire appropriate for both the office and field visits, practicing effective verbal communication with staff and clients, and last, submitting all written documentations and reports with attention to clarity, tone, and correctness. I take feedback seriously, meet deadlines, and uphold the values outlined in the NASW Code of Ethics in all interactions. And this concludes my presentation. Thank you. Very boring, ain't it, babe?
I can call full time now?
I'm through.